Good morning, madam. My name is Andrew Koo, and I'm from Team Tugu Abdul Razak. Today, I'm going to present about Krisis Mental Kesan Pandemic COVID-19. It is found that separation from the primary caregivers can make a child more vulnerable and can pose a threat to a child's mental health. It may develop feeling of sadness, anxiety, fear of death, fear of parents' death, and fear of being isolated in the hospital, which may pose a huge impact on the child's development. The home confinement of children and adolescents is associated with uncertainty and anxiety, which is attributed to disruption in their education, physical activity, and opportunities for socialization. Absence of structured setting of the school for a long duration results in disruption of routine, boredom, and lack of ideas for engagement, academic, and extracurricular activities. That is all from my part. I will pass on now to Jay.
Thank you, Gilsiri. I'll take it over. We are going to talk about mental health issues. We're anxious, depressed, and traumatized as COVID 19 spread through China in January and February. Researchers were already sending out questionnaires to citizens locked down in their homes. In a half a dozen studies with 10,000 respondents, they found that people were experiencing worse mental health problems than before the pandemic. High systems of stress, anxiety, depression, and PTSD. Up to the half showed serious signs of depression. Depending on the studies, while up to 35% showed serious anxiety. One survey followed over 1,700 people in 1,900 cities, Chinese cities, from late January to the late February. During the height of pandemic, their stress, anxiety, depression didn't change. Their symptoms of PTSD declined slightly, but they were still high enough to become worrisome. People weren't getting worse, but they also didn't seem getting used to the pandemic life. And studies find that this stress and anxiety fuels poor sleep, creating a vicious cycle. The more we lay awake at night during the pandemic, really rehearsing worries we have no control, the worse our mental health becomes. With this being said, the effects depends on your personality, lifestyle, and the demographic. While older people have greater health risk from COVID-19, it seems to be younger people who are struggling emotionally. According to the studies from Spain, China, and Slovenia, younger people tend to be more depressed, anxious, stressed, and traumatized of the era of COVID-19. The same is true for women, who may also be more lonely, not to be sexist. There's no clear explanation for why this might be true, but researchers have some speculation. Women tend to have worse mental health in general, and certain stresses right now, like the added burden of caregiving to the risk of losing job, may fall more heavily on burden because they take care of their men. For younger people, it could be the disruption of their routines that are blamed particularly for college students who have had the adjustment to online schooling. In studies across both China and US, the more pandemic was affecting people's daily life, the more anxious they felt. Personality also influences how we are fair in rough times. Two related traits that seem to be matter during the pandemic are our ability to tolerate uncertainty and our ability to tolerate distress. While it's for everyone to hard for anyone to struggle the face of the unknown, some people are less comfortable with it than the others. And right now, those people who seem to be ruminating more, feeling more afraid, and experiencing more depression, anxiety, and PTSD. I'll pass on to the Andrew Emmanuel about the statistics and result. Thank you.
In 2020, a significant threat to public health emerged. The novel served acute respiratory syndrome coronavirus 2 epidemic outbreak emerged in December 2019 from Wuhan City, Hubei province, China, and spread to the rest of the world. This disease was named COVID-19 by World Health Organization. In 17 April 2020, a total of 2,023,439 cases of COVID-19, 150,810 cases of death, and 564,210 recovered cases have been reported worldwide. The outbreak of COVID-19 from a Malaysian perspective was explored and mental health care during the COVID-19 outbreak. To date, there is no vaccine or specific treatment for COVID-19, therefore, preventive measures are very important to prevent and control the rapid spread of COVID-19 virus. Preparedness should be a priority for future pandemic outbreak. Now I'll pass it down to my fellow member, Divya.
As according to the statistics shown, data were weighted to be representative of the target population by age and gender. Mental illness has been played a cruel role on every victim's life as in the report, thus showing mental illness is not being taken lightly and has to be addressed with a serious care, or if not, human's life are at stake. Okay, let's see the first point. It's normal to be feel sad and stress and feel anxiety and depression due to this crisis. To overcome this problem, do contact with your loved ones and there are through social media platforms. Stress also may cause changes in appetite, energy, and our interest. So to overcome this lifestyle, maintain a happy lifestyle and including proper diet, proper sleeping, and limit your worries and enhance your skill, which is used in the past that have helped you manage your previous lifestyle, advertise your skill, and it also help to control your emotions during this challenging time of this outbreak. Other than that, we also face some difficulty in concentrating and making decisions, such as also as physical reactions, and also headaches and then body pain and stomach and skin rashes. To overcome this problem, please consult your health or counselor to refresh your mind. Apart from that, due to high stress, we also may cause a difficulty in sleeping, so that we can join meditate yoga classes due to this pandemic to control our stress. The last one will be worsening of chronic health problems and worsening of mental health conditions. As a solution, we may consult to our doctor and then for a medical checkup as recommended by our health provider to back to our healthy lifestyle. So now I'm passing to my friend who's going to talk about the impact of COVID-19.
Good morning, madam. I'm Umadeshni. Today I'm going to present about mental crisis effect of COVID-19 pandemic in Malaysia and abroad. In a fast-paced world without border full of uncertainty like the COVID-19 pandemic, the heat has caused many countries to carry out restricting orders and closure of activity socio-economy, including Malaysia. Most of the society has lost its source of income, perform social isolation, and limit social activities, which are among the risk factor measure and significant for the occurrence of mental health disorder and affect the level of well-being. This study examined the mental health and well-being of Malaysian society throughout the movement control order to prevent the spread of the COVID-19 pandemic. The result of the study in China, the mental health of Chinese society to review the psychological effect of anxiety, depression, and the pressure of the Chinese general public during the COVID-19 outbreak, and found more than half of the respondents agreed that the COVID-19 outbreak had an impact of their mental health moderately or severely. Thank you. Now I will pass it to Tinesh.
Thank you, Uma. My name is Dinesh. Now I'm going to present our next chapter, which is healthy ways to cope with stress. Stress is normal human reaction that everyone have. Take breaks from watching, reading, and listening to news stories, including those on social media. It's good to be informed, but hearing about the pandemic constantly can be upsetting. Consider limiting news just a couple times a day, disconnect from the phone, TV, computer screen for a while. Take a deep breath, stretch, meditate, exercise icon. Try to eat healthy, well-balanced meals, exercise regularly, get plenty of sleep, avoid taking too much alcohol, tobacco, substance use. Stay positive and practical, gratitude, acknowledging to good to be part of your day or life. Stay connect with people who keep you calm, make you happy, provide emotional support, and help you with the practical thing. A family and friend member, neighbor can become a good listener, share responsibility, stress, and become overwhelming. Get vaccinated with COVID-19 when available. Make you unwind, try to some other activity, enjoy it. Now
Finally, I'll take it away with mental health and crisis. If you're struggling to cope, there are many ways to get help. Call your healthcare provider if stress gets in the way of your daily activities for several days in a row. During times of extreme stress, people may have thoughts of suicide. Suicide is preventable and help is available. More about risk of suicide, signs to watch out for, and how to respond if you notice these signs in yourself or your friends or loved ones. Individual relationships, community, and society factors may influence the risk of suicide. Now, the suicide warnings includes feeling like a burden, being isolated, increased anxiety, feeling trapped or in an unbearable pain, increased substance use, looking for a way to access lethal means, increased anger or rage, extreme mood swing, expressing hopelessness, sleeping too little or too much, taking talking or posting about wanting to die, making plans for suicide. That is all from all Please make sure to be safe during these hard times. This is Team Abdul Razak's team leader Jay Krishan signing off. Thank you everyone for watching. In conclusion, the mental health impact of the COVID-19 pandemic can persist and be long, lasting for several years after the pandemic. Increase in prevalence of common psychiatric disorder and suicide are expected during the post-pandemic time, enhancing access to the mental health services including telepsychiatry, early assessment, treatment, and psychosocial support, screening and support for specific groups such as the frontline HCP, where appropriate implementing long-term measures to migrate the impact of economic recession on mental health and addressing stigma during the pandemic are paramount in addressing the problem.